Welcome to Healthcare Quality and Risk Matters, the show where we dive into the topics that matter most in healthcare quality and risk management. Wondering about patient safety, quality improvement, or risk mitigation, but weren't sure who to ask or were afraid to ask? Well, you're in the right place. We create a safe and judgment-free space to explore these critical topics together that will leave you informed and inspired to make a positive impact on healthcare and patient outcomes. So let's learn and grow together because healthcare matters.
Well, good afternoon, everybody, and welcome to this March edition of Healthcare Quality and Risk Matters. My name is Gary Bierce. I am the CEO of Aperitisoft Healthcare, and I am joined by my co-host and comrade in arms, Rob Sandamore, who is our Chief Operating Officer. Thank you for tuning in with us today. Hey, Rob, we've broken a record. Ring the bell somewhere.
I know. I wish I had one. Like, I legitimately want a bell today.
Yeah, folks, we have had 1,100 people sign up for our session today. So thank you for all who have signed up to be here. We're going to be hopefully getting your comments and your questions flowing through LinkedIn, and we'll try to respond to those throughout our session today. So please do so. If you'd like, go ahead and just put in a little thing and tell us who you are and where you're from. We'll that way recognize you out there as we're going through our session this next half hour. Today, we are doing the first of a series that we'll do throughout the year this year that will be more instructional podcasts. And we're going to be focusing in on what we call our quality management wheel. Rob, why don't you put that up and let's kind of get things started right away so we don't waste any time. We have shown this many a time before during our podcast. We are actually beginning in the third step today, and we're going to be talking about root cause analysis. Rob, you want to tell everybody why we're starting at number 3 and not number 1?
I think that we have, over the last couple of years of doing this, spent a lot of time on theory. So I'm very excited about this new series that we're doing of the applied science of healthcare quality, risk, and compliance. It's just the logical next step. And through all of that discussion around theory, we've really hit home the need for there's strong reporting and investigation. We've been really clear with our audience with there's engagement around the just culture, the high reporting, the near misses. There's getting all of the good information. There's in your initial assessment. But then what do you do with that? We keep saying report it. Good risk management, make sure you know what's going on, good line of sight. But how are you identifying your next action? And your next action is identified through your root cause analysis.
And look, I want to talk a little bit about this too, because from a importance perspective, me as a risk manager and looking at risk management best practices, getting to root causes, getting to factors in general, root causes and potential consequences of an incident is really at the heart of best practice leading risk management technique. Because when people talk about CAPAs, corrective action plans, right? Well, you don't address incidents or audit findings per se with a CAPA. You're addressing the factors, the root causes, the consequences to those things when you do a CAPA. So
I love it. I love everything you just said so much, and I feel like they should put that on some type of audio reel.
Yeah, because many people in risk management, they mix this up all the time. And a lot of time, I think it's a lot of the software tools are out there are just, they don't understand the integrity. They don't understand the integrity.
Into CAPA. Yeah.
Yeah. When we address risk, we're addressing the things that bring rise to a risk or the things that are the result of a risk. That we can address, right?
Yes.
The risk itself, right? By addressing the causes, we're minimizing the probability, right? By addressing the consequences, we're insulating ourselves from what potentially could affect our organization. So getting into root cause analysis and truly doing it the right way, in my opinion, this is like going to basic training for risk management.
I couldn't agree more.
You got to do this right. So yeah.
I can't tell you how many times I have audited or seen response in a response management system. There's where somebody performed an action against policy or process. And the CAPA immediately was, oh, I provided counseling and education for that staff member. Or this was a one-off. That's my favorite. And by favorite, I mean it very ironically. This is a one-off event, so we're not doing anything about it. And you're jumping right from your incident to your CAPA. Without figuring out the actual why, and not why in a linear way.
Right. Now we're gonna talk in a minute. We'll dive more into risk cause analysis, or RCA, for the audience out there. But there is a metaphor we're going to be using, right? The 5 whys. And folks, by the way, it's a metaphor, okay? For all of you compliance people, quit making things so, what's the word I'm looking for? Precise or exact. I mean, the idea of the 5 whys is to keep asking, right? If for those out there who know different quotes that come from different places, have you ever heard the expression 70 times 7? It's not a literal formula. It's a metaphor for all the time, right? So when you're asking why, remember, as we get into this, you're asking why until you can't ask why anymore. That's really what it means. Why don't you go ahead and put that up, Rob? Let's go ahead and get into RCA, and I'll let you kind of lead the overall review of this, and then I'm going to probably pepper you with lots of questions.
I love it. And I welcome any questions or thoughts in the comment section from the audience of things that go really well in your organization that you can share with other viewers and listeners. And any questions that you have for us, on best practice. One of the reasons I get so excited about RCA and this concept of RCA, is responding to your incidents or audit findings in a very holistic, systematic way. There are many causal factors that need to be considered. In each of those deserves its own 5 whys. It is not a linear, why did I, old transplant nurse, right? So lots of incidents from transplant days. Why did the left kidney go to Michigan when the right kidney was supposed to go to Michigan and the left kidney was supposed to go to Pennsylvania? And I just ask why, and then somebody responds, well, Gary was tired. Why was Gary tired? Well, because Gary's been on shift for 24 hours. Why was Gary on shift for 24 hours? Because that's our staffing model. Why is that our staffing model?
Right.
That is a very linear thing. And when you get to your root cause and you've identified the staffing model, as your root cause, and you didn't consider anything about the human factors, policy, protocol, communication, your technology. There's the actual workflow versus policy workflow. And you'll notice in this graphic, there's the difference between policy and process. We separate this out for our clients because policy is not always process. Would we love for process to always follow policy? Yes.
Right.
That the reality, no. So it deserves an assessment. The environment, the safety culture, there's training and competency. All of those things deserve a thorough assessment. In a spider web, right? You're creating all of you're creating an assessment on all of the confounding factors. And then you are able to tie those back together with those end strands.
In true root cause analysis, some of the things that you might say is a cause, it's not a cause at all. It's a sub-event.
Yes, right? I totally agree.
Like Gary being tired, that's a sub-event. Well, why was Gary tired? Gary's on a 24-hour shift. Okay, well, that's an event as well. Gary shouldn't be on a 24-hour shift. So you have a sub-event creating another sub-event. Eventually, we get to the root cause,
Yes, you hope, right? As long as you are taking that holistic approach that we are
This metaphor, the 5 whys, is also used in other places in investigative type of professions, such as criminal investigations. They use the same concept of the 5 whys.
True.
We do it throughout the risk management world, particularly when we're dealing with root cause analysis. It's an important concept, but we just want to make sure that our audience today knows you don't stop at 5. You may only have to do 3.
You might.
Right? But you may have to go 10.
Agreed.
Right? The idea is keep asking, right? And get to those root causes. So why don't we give everybody an overview of what we have up on the screen here, and then I'm going to pick it apart.
Yeah, I love that. So for those that are listeners only and can't see the visual, we have a very high level like guide. There's to what is assessed and the during an RCA, starting with an immediate response and escalation to the event. There's or assessment finding. There's you're then moving to evidence collection and then into your RCA itself, where you are looking at the causal factors, human factors, policy and protocol, communication, training and competency, process and workflow, technology and systems, environment and safety culture. And then off of those, your 5 whys or 13 whys or 2 whys. There's to Gary's point.
And then you have like categories of factors, right?
Yeah. And across the bottom, anybody that wants any of these have been really popular to bring back for education, especially for like quality, risk, and compliance teams. We share them openly. There's a ticker at the bottom that states insight at aperisofthc.com. So take a snip of that email. Let us know.
Coming across right now. Insights at aperisofthc.com.
Perfect. And let us know if you want any of these materials, and we'll get them right over to you, usually in about 24 hours.
And by the way, folks can't stay for the whole 30 minutes. There is a QR code that we have up on the screen right now. Go ahead and scan that if you'd like to talk to us one-on-one. We'd be glad to chat with you about your program, what's going on, help you with RCA, whatever it is that you have an issue with. So go ahead and scan that QR code, and we'd love to help you. All right. So these eight causal factors. Now, is that these categories of factors, Rob, is that the exhaustive list?
No. This is where we like to talk to our clients about your starting point. There may be times that some of these just don't apply, but what we want to do is frame in the idea that incidents aren't because of one causal factor 99% of the time, right? There's confounding factors, there's apparent causes, there's lots of things that are impacting. There's the work that we're doing that cause an incident.
Yeah.
And so you may have more than these. There's like one of the things on here is contracts, right? I think of, and it's a little bit more rare. But what are the administrative responsibilities associated with a particular incident? Because I've seen contracts be the root cause. There's which you could argue is communication.
Yeah.
There's
what you're saying to the audience is, here's a starting point. Look at your organization and understand what these factors might be, and make this list your list. So if you have contracts, add contracts as another causal factor type that could exist within your organization. The key is when we're analyzing this stuff in aggregate, these become pathways of aggregation.
Yes.
Right. And for analysis. So make this list your list. We came up with 8 that are common that pretty much everyone should have. You might have 12. Somebody else might have 15. Another may only have 10. So we highly recommend that you just kind of get this thinking process started before you begin your RCA.
Agreed. And just another plug, each of your causal factors needs a set of whys. there's a deep dive into everything associated. So asking yourself, is this a causal factor? If I captured them all, a quick Google search will tell you to assess like people, methodology, technology. There's right. So like assessing those basic things for every single incident. A root cause is not a 5 why. There's on an initial factor that first pops into your brain. The initial evidence collection, there's needs to be categorized, right? You're observing, you're structuring, there's your evidence, and then you are doing your initial RCA analysis, which sounds redundant, right? But what are all of the causal factors that are going to guide your RCA assessment?
You might have a questionnaire, right? You might set up some questions that will prompt you to know this incident has human factors involved, right? Something like that.
Agreed. The very first RCA form, and I'm using giant air quotes on form, it was a whiteboard form. And it was, what was the incident? What was done about it? And then what contributed to it? And then off of that statement of what contributed to it, we would then ask, there's why. And there was 5 boxes. And we would say, this happened because of this, using the kidney example, right? And we got to so many root causes that were not things that fixed the problem. And why we care about this so much is because in that safety wheel, in order to move on to corrective action and preventative action effectively and ensure there's system of high quality, low risk, high compliance, to identify the actual root cause or root causes. And otherwise,
it's kind of like a doctor, right? A doctor, you're sick. Doctor comes and looks at you. He wants to make you well, or she wants to make you well, right? They want to know what to treat. Just treating symptoms isn't going to make you well.
Symptom management, there's diagnosis of like disease process, right? When you're treating symptoms, you cover up. When you hide symptoms, you cover up indicators for root causes. So if you're putting a bunch of Band-Aids in your organization because you've put a bunch of Band-Aids in place based on, for lack of a better way of saying it, bad root cause analysis,
right?
You have a much higher risk organization than somebody who even does half the number of RCAs, but they do them well. And we've seen that over and over with our clients who, hey, we're doing great. Look at all the CAPAs we've closed. And then the Joint Commission comes through and you have 61 findings. And in your SAFER matrix, they're in the upper right-hand corner. And all of our Joint Commission people know that that's a bad place to live on your SAFER matrix.
Right.
If not conditional level, right? Real good root causes that are getting to the root of the problem. In this process, to me, is best laid out. And I love your bow tie. There's a diagram, Gary.
But we'll get
there. And I love that layout. I love a bow tie diagram. I think a fishbone diagram has its place. And those are if you don't have technology, right? Some technology will help guide this process for you and get really good in-depth analysis and answers.
Well, let's take a step back, Rob. Let's do this. All right. We've got an incident happens, right? In our chart here, we're saying there are 4 basic steps you need to go through once that incident has happened and has been reported. Why don't you walk the audience through that?
So it's an immediate response and escalation, right? So it is stabilizing the scene or the situation, right? Your initial risk mitigation process. And then documenting everything that you've done. That is really important to have something that documents what you started with, what you did. And then moving on to assemble your team and figure out a culture, right? And figure out's the wrong word, establishing a culture of safety so that everybody knows that this is a just culture. We're trying to get to the root of the problem, which likely is a system or process issue, not a.
Therefore, no suggestion is a bad suggestion.
Yep.
No matter how embarrassing it might be to somebody.
And this is, again, still all in this discovery phase, right?
Okay.
There's agree on a shared investigation plan before any analysis begins, and then gather your evidence. There's there's converging streams of evidence should exist. And that includes medical records, policies, direct observation. Get out there. There's do your Gemba walks. There's figure out what you're actually seeing. This is a great way to assess process versus policy. There's do structural interviews. And again, all of these things need clearly documented because the information needs to make it to the RCA. There's very cleanly. There's and not be lost in translation over the course of the week. There's because I left it on Post-it notes. There's on my desk. There's and then any historical data, right? What are some associated trends? What are some other like incidents? There's this is my favorite piece of evidence to collect during an RCA. What are all of the other things that have happened that are the same types of things? And that is another set of whys to ask. Why did we identify this as the root cause? Why did we act this way? Then you have an ever evolving, ever growing organization where there's continuously improving. Then you actually move into the RCA where you're systematically investigating. There's all of your 8 causal factors or your causal factors. There's with guided assessment questions and the 5 why causal chains with no assumptions, facts only.
So these guided assessment questions, it's going back to what I suggested before, that you have a set of questions for each of your causal types, right?
You do have to have that, agreed.
So that's trying to red flag, did this incident have anything to do with one of our causal types, right? So that it's a good tool. It's a really good tool because it immediately gets you honed in and able to document why you felt it was not a human factor. Right?
Yeah.
Now, the other thing I think we should reiterate, and we talked about this in other podcasts, is you must, I think you said it a minute ago, document everything, but explain everything is another way to put it. If you say that I don't have a human factor, explain why you believe that it is not the case.
Yes.
Right? And document this. And let's go back to another podcast. Why do we document? Because he who documents wins.
So that's a true story. And your RCAs are often, there's something that are turned over to, there's your attorney, they're turned over to, there's the Department of Health, to Joint Commission. These are, in a way, there's discoverable documents, not every time, right? But we use them, as evidence to prove that we know what's wrong and that we're going to do better.
Right.
I don't know that I've submitted to a regulating or accrediting body or an attorney without some kind of RCA included.
And if your systems out there, guys, do not give you the ability to keep an integrated set of documentation, give us a call. We'd love to help you there. I'm giving ourselves a plug because we thought all this through when we developed our software. If you don't have that capability, it makes a huge difference in how you're able to manage this stuff. An enormous difference. So, Rob, we focused in now. We've kind of drilled into doing an RCA. Okay. Let's now back up and focus away from it a little bit. Why don't you go ahead and put up a bow tie chart? Okay. So I'll explain a little bit on this, but we're going to focus away, folks, on this. As you see in the center of the bow tie, that's the incident that occurred. Your RCA is trying to get at those root causes, and you see those listed over to the left-hand side. Now, in between cause and incident could be those sub-events we were talking about, which were higher up on your why questioning before we finally got to the bottom where we found out what the root cause is. But did you notice in this diagram here, it's not one root cause. There may be multiple root causes.
You're saying things that make my heart happy, Gary. And
risk management. This is all good risk management. I know in the healthcare space, we don't think of risk management this way. We think risk management is the insurance department.
No. we need a thing to focus on. There's for some reason root cause analysis sounds singular. So we need a singular thing to fix that will make everything better magically.
Right. Which oversimplifies this process.
Yeah, people aren't simple, and healthcare is people. It's working with sick people. It's getting people better.
And root cause analysis doesn't have to be just cause. If you notice, there's a right-hand side to this bow tie.
Mm-hmm.
They're often called impacts. They're often called consequences. They're called a lot of different things. But after the incident occurs, what could it do to us? It could be a lawsuit. It could be, and hopefully in doing our analysis, we're all looking for this. Was there a threat of a lawsuit? Was there a official complaint, patient complaint? Did somebody get hurt? Some very fundamental questions similar to those 8 areas of cause. We need to be thinking about what are the areas of consequence and keep asking the why questions to get at what those might be. Now, what we're establishing here is a framework that when you do get to CAPA, you know what to aim at. That wasn't very good English there, was it? So you know what to aim for. You have your constants, you have your consequences. On this diagram, you see these vertical bars. They're representing those CAPAs. So you're either going in there and you're helping to prevent and creating control barriers so that incidents don't reoccur, okay? Or we're trying to recover from the incident and put in different defense barriers that will minimize its effect on the organization.
Mm-hmm.
We've now closed the entire loop on how we manage risk. This is what we're trying to get to. So we'll leave this up. We've got about 3 minutes. Why don't we ask some questions from the audience? Has anybody got any questions you'd like to ask us about what we've gone over? We fire hosed a little bit over this 30-minute segment.
I think
we'd love to answer your questions.
I think that we've talked a lot about process, and it sounds like we have a lot of active listeners. No real comments, but a bunch of people joining and letting us know where they're from.
We'll give you guys a minute to throw up your questions or comments. Please do.
But I do want to say, I think that you gave our audience, there's a great way to work backwards if they need to figure out some of their causal factors to consider. That can be really hard to figure out. I have sat for hours with quality risk teams. And trying to coach them through figuring out their organization's causal factors. How are they going to systematically approach their RCAs in the future? And I think working backwards from consequences, like you were saying, Gary, right? What are our consequences here for these types of incidents that are coming through? And that can help frame in that thinking and conversation around what your causal factors that you can use to assess your incidents in the future.
Yeah, we certainly don't want anybody to think that this is easy.
It's not. This is a very challenging process that so many do. Everybody does these, right? Every healthcare institution is required to do these.
Yeah.
But so many have never been adequately trained. They've never had somebody sit down and give them a full day workshop. They've never had somebody do a 2-day workshop. I've sat through 2 or 3 day workshops on some of these things. These are really hard concepts to come up with and figure out how to operationalize, especially when you are doing them paper and pen style. And not just paper and pen, but like forms that you're filling out online, right?
A manual
process. They can be really hard to move the information appropriately through an RCA process. So we understand that we have 30 minutes to frame in something that could be days-long workshops on how to implement it. But hopefully this gives really good talking points. And frames in the general how, needing to identify your causal factors, asking all of your whys on those, thinking about things in the concept of this bow tie diagram, and making sure that there's potential causes, have appropriate quality controls, and you're minimizing the negative consequence in your organization.
Before we close, Rob, why don't you go back to the previous slide? And if folks need that, go ahead and screenshot that if you'd like. I'll give you a couple seconds to screenshot that. And Rob, why don't you move over to the other one? And we'll give you guys a chance to screenshot that one. If you like original copies of this, email us at insights@aperitsoft.hc.com. It's scrolling across the bottom of the page right now. Or you can contact us for an appointment by using that QR code, and we'll have a one-on-one chat, talk about your program and how you're doing your RCAs, give you whatever advice we can possibly do for you.
That would be fun. I love those conversations. And a lot of times that's what they are. They're just a conversation, and they are very fun.
Well, Rob, in closing, all I can say is, wow, broke a record today with the number of folks signing up. And it's not us, it's you guys out there supporting us, liking our podcast, sharing it with others. Please keep doing so. We love you for it. We also have on our YouTube channel, you can find us there at Healthcare Quality Risk Matters, and you can see all of our old podcasts. They're all out there on YouTube, and love to hear from you. Please give us some comments. Go to our profile and give us comments there as well. And until next time, next week, next month, in April, we're going to be talking about Donate Life. Are we not?
Very excited about that one.
Yep. And we're going to have a special guest host, or maybe hosts, next month, who are everything about Donate Life. And I can't wait as well. It's going to be a wonderful conversation.
It is.
Thank you, everybody, for joining us today, and we'll see you next month.